Since the start of the pandemic, hospital staff have constantly worn face masks, but now patients and visitors are being asked to join them. In all our hospitals, there are 228 patients with flu, 119 with COVID. And mask wearing is one way they hope to stop those numbers going higher.
If we had a rise in the number of flu cases and COVID cases, it would make our bed capacity even more stretched than what it is. Not only that, if you have either flu or COVID in patients who are recovering from operations or recovering from another illness they got admitted with, it would delay their discharge and also have a negative impact on their recovery.
At the height of the pandemic, masks were everywhere, on buses, in shops, on the street. Today, seeing someone wearing one out and about is a rarity. But public health officials say going back to the pandemic message of hands, face and space will help stop the spread of flu and COVID.
There is a really strong evidence base now that if people are wearing face coverings, it will reduce your risk of catching the disease. If you've had all your vaccines, that's going to reduce your risk of catching the disease. If you keep 2 meters plus from people, that's going to reduce your risk of catching the diseases.
While some don't mind the return of face coverings, some are glad to see the back of them.
I don't want to go back to having to wear them in the shops. We've all had in our injections and things.
It's not too much of a difficult thing to do. If you feel unwell, you could just wear a face mask.
People are quite blasé, aren't they? Oh, it won't happen to me. But obviously you just don't know.
If you're coughing and spluttering, everybody's just going to spread it and everybody's going to get it. You're going to have another pandemic before you know where you are.
But some public health officials say even more than masks, getting more people vaccinated against COVID and flu will be key in fighting the current wave of respiratory illness. Anne-Marie Tasker, BBC Look North.